My name is Michelle Mras, and I'm helping my friend Susanne with her exceptional exit plan. Tuesday, January 28th, 2020. I like to watch a few medical dramas. There does not seem to be any rhyme or reason as to which ones I even watch a single episode of, let alone watch regularly. I've never watched an episode of Grey's Anatomy and did not even know there was a Dr. Gray on the show until I saw a commercial recently in which someone called a woman Dr. Gray. I never watched St. Elsewhere, but I have seen one episode of Chicago Med. I usually watch crime shows like NCIS, FBI, and How to Get Away with Murder. Oddly enough, I have two doctor shows I have been watching the past couple of years. One of those shows is The Good Doctor. The main character is a surgeon with autism who finds gently breaking news to people difficult. I like him. I like doctors who do not try to spare my feelings. Some people think I do not like my oncologist because I call him Dr. Doom and Gloom, but that is not true. I really like Dr. Doom and Gloom. He tells me exactly what I need to hear. Last April, when Dr. Doom and Gloom kept me in the hospital for an extra week because some infection number had dropped so low they even had to take special precautions while preparing my meals, he told me if he sent me home in that condition, I might die. I needed to hear those words. I may have a wrecked body and be dying of cancer, but I am invincible in my mind. I had been in the hospital 2 weeks already and felt fine, so I did not understand why extreme risk of infection should stop me from going home. I decided I could stay in the hospital rather than go home and possibly die. On last night's episode of The Good Doctor, a man had been reacting badly to his chemotherapy treatments and decides to discontinue them and better enjoy his final days. He is told he has about 6 months to live without treatment. The man decides to skydive, buy a Lamborghini, and move to Costa Rica for his final days. His wife was upset that he was spending all their money. And he said the most selfish words I've heard. He said he could spend all his retirement money because he did not need it. His wife still needs that money. She is not dying. I do not want to spend any money on me because I do not need whatever I would buy, except more space heaters. And that little bit of money would help those I leave behind. If my health and circumstances work out, I plan to take my family trip to Florida in July. So I have been saving for that, possibly, and think it's a good use of money. The man on The Good Doctor wanted his wife to quit her job and move to Costa Rica until he died without any money left. He chose his "this is the true me" life instead of his wife. A friend of my significant other, Donald, died from cancer a couple of years ago. He and his wife had about a year warning, and they enjoyed their time together. They traveled a lot before he was diagnosed, and they took a few more trips to special places while he was still able. He hosted Wednesday nights with his old buddies so they could have quality time before he passed. I know Donald treasures those memories, and I am so glad he went. The friend made sure his friends had items of his they would want. Donald received some scale models and tools. Someone else may have received woodworking tools. The true me is like Donald's friend. I am working to make my passing easier on my family, not leave a mess for them to deal with. I am clearing my physical mess, getting my paperwork in order, and writing and recording video messages to comfort them emotionally after I pass. My piece of advice to you is discover the true you. Would you enjoy your final days with your friends and family, or would you go out in a blaze of glory alone?